All right. So let's moving on. We are still on how we got that 700,000 naira. I'm showing you. All right. So I'm converting this one, this time. Okay. So we were talking about the building. Talking about the building. All right. So talking about the building. So we said that for the building, we said 4-bedroom flat is what we are looking at, and it goes for 300,000 naira for a place like Ikorodu, where I am, depending on your area. And I also said that a place like Edo State, you can see for 150, specifically in Uwelu, for those of you from Edo State. But for places like VI, if you are the one that always have eye for big things, you can get it for 1.8 million naira. So a woman said, for Kaduna, 2-bedroom flat is 500,000. So you can see that in all of this, you can see that it depends on your taste. Am I right? It depends on your taste. You understand? It depends on your taste of environment. That is why I said location. You must decide your location. Now, the next thing we will talk about after building, the next we talk about is equipment. Equipment. And what are those equipment that you need to have? What are those equipment that you need to have? Number one, are we all following, please?
Yes, yeah.
Number one, we wrote it just now. Number one, oxygen. It's very important. Oxygen or oxygen cylinder, oxygen concentrator, sorry. Oxygen or oxygen concentrator. Number two equipment that you need to have is 4 beds. 4 beds. 4 beds. Okay, let me put the price. Oxygen cylinder. Oxygen cylinder is 25,000 naira. Depending on the size, but cylinder is cylinder. Oxygen is oxygen. Okay. Oxygen is 25,000 naira. Wait first. I'm coming. You will appreciate it more if I do it in. I know, say I go computer school that year. Some of you will be laughing at me, say, this man don't know how to use results. Let me use table. I know what I'm doing. Let me use table. Don't worry. I know
We
that.
understand it like
some of you will start dragging me now when you leave. Say, this man, no, I know. Location. Amounts. Location, amounts. So amount for this location. Let's talk about, let's say location, 300,000 naira. 300,000 naira.
And why do you like?
Okay, no, sorry. No.
Why can't you come and report them? Leave this game. Leave this game. Shut up. Why can't you come and report them? Leave this game. Shut up your mouth. You want to show you.
Okay. All right, so accommodation building is accommodation is 300,000 or building. Then equipment. Okay. For the equipment, so let's go upstairs to list out the equipment we will be needing. I hope you guys are following what I'm doing. You understand what I'm doing. 4 beds. 4 beds. When we meet by 4 bed and mattress. 4 bed. Let me just do this. 4 beds, excluding mattress. When I mean by 4 bed, I mean 4 iron bed. Then 4 iron beds, 4 drip stands. 2 baby cots. Hope you know what is baby cot.
Yes.
1 delivery bed. 1 theater. 1 theater bed. 1 examination. 1 examination couch. 1 examination couch. 4 drip stand. What am I forgetting? Now? 4. Okay. Now, this 4 drip stand, 1 drip stand, 1 baby cot, 4 drip stand. Okay, now all this, you can meet iron bender, those welder, they can construct this for you. They can construct this for you for a maximum of 200,000. I know I did my own for 160 3 years ago. So I'm trying to add more figures to it. For a maximum of 200,000. If you're in Lagos, I can give you a contact.
All of this?
Yes. I can give you a contact. Taiwo, where's his contact? Taiwo. Okay, yeah. So I can give you his contact. This is his number. You can take his number. If you are in Lagos, if you are not in Lagos, you can also ask him to do it, and he will bill it to you wherever you are. You can do it 304 7799. Yes, his name is Taiwo, Mr. Taiwo. He can, that's his job. Just tell him from, he know me as doctor, so you can tell him from the doctor in Agric, Ikorodu. You can give him my number, so you understand. I've referred so many people to him. Hope you are seeing the number.
Yes.
So all this equipment, for when you have this, your hospital or maternity or nursing home is set. Hope you agree with me. Do you agree with me? When you have all of this.
Theater bed now.
This is the theater bed.
Why? There is no surgery done in the maternity.
I'm just saying in case it's an hospital.
Okay.
If you remove the theater bed, the money will decrease. It becomes cheap. Because only this theater bed is 50,000 naira.
Okay.
Yes. Only the theater bed is 50,000 naira. So in case, so that will bring us to our balance sheet. We'll put equipment 200,000. Now, facilities. When we talk about facilities, we are talking about oxygen. Okay, let's push this downward. Now, oxygen. Nebulizer. Nebulizer. How much is the nebulizer?
You don't know.
You can import it and it's cheap. Some of this equipment you can import it. You'll be taught how to import. Nebulizer currently is 25,000 naira. 55,000 naira. What else? Refrigerator. You can also import that one. So it's not going to cost. Refrigerator. If you want to go for a new one, maybe you are the type that doesn't use people's property. You can buy your own 50,000 naira for a mini refrigerator. What else? What else? What else?
Suction machine.
Suction machine. You see that you have so many equipment to import. So you bring suction machine. How much is it? 30,000. 30,000. You know, there are different types. There are different types of suction machine. Let me show you. There are different types of suction machine. Let me show you suction machine. Can you see it? Can you see?
Yes, we can see you.
All right.
This ones are electric. We have
Yes,
manual.
we have manual, yes. So these are different types. Some are manual, some are manual, some are electric. This particular type, where my arrow is 20,000 to 30,000. This particular one that has one bottle. This one has 2 bottles. This one is a little bit expensive, but if you are importing it, it's going to be cheaper. So this one has 2 bottles. This one has 2 bottles. So you can actually import that. Okay. Okay. So
How much are we putting for that?
So we'll put 30,000 naira. 30,000 naira. What else? What else? Delivery equipment. Yes, delivery equipment.
Autoclave.
Yeah, yes. Equipment 25,000. Autoclave. Autoclave is 100,000.
Money down the
Autoclave 100,000. What else? Somebody mentioned what a weighing scale. You can buy that small one now of 5,000 naira.
Okay. Ambo bag.
That one. Okay. Let's just put it. Ambo bag. Sometimes it used to come with suction oxygen cylinder. Those ambo bag, but you can buy.
Okay.
That ambo bag is 7,000.
Oxygen cylinder.
Pediatric ambo bag.
That's the ambo bag I'm even talking about.
What of the emergency trolley?
Emergency trolley. You know, emergency, there is no such thing as emergency trolley. You are the one that will buy a trolley and make it and put all those emergency things inside. Do you understand?
Yes.
You are the one that will buy
Your
a trolley.
camouflage.
Eh?
Camouflage or
this-
thermometer.
These are the equipment, all those ones. These are the basic.
Photometer.
These are the basic. So let's calculate. We have 100,000, 105,000 naira here, 130, 230, 230 now, 235, 242. We have 242,000. So
Okay.
let's go to our okay, 242,000 naira. So adding up, we have 500. How much do you have here in total?
742.
Was I right or wrong?
742. You're almost there.
Remember, this equipment is not everything you must have. I always tell people, it's not everything you must have. You can start with this one.
Something.
Yes, this one, like this autoclave. You can be using boiling method.
Yes.
Before you buy,
Yes.
yes, you can be using boiling method, right? You can be using boiling method. Depending when you have money, you can buy a proper autoclave. Most hospitals use boiling method. Even general hospital, they still boil with gas. So you can be using boiling method. So you can there's like this weighing scale. You can start buying all this equipment gradually. You must not wait till you start before you start buying. You can start buying all the equipment gradually. So you can see that when you have 700,000 naira, you can test it. If you have 700,000 naira, you can test it. So you can see it. You can see it. Any question? Any question? Any question? Ask your question now. Ask your question now. Nobody has a question?
Hello, sir.
Yes.
Thank you very much for that beautiful presentation. I was saying, what I understand is a cash cart where everything in a bar emergency is being kept. It's just like it has little trolleys. It's like a trolley anyway, where it has like cupboards.
Okay. Cat crash, right? You can type in your question. Bumi, go on. Bumi, go on. You can, Saliu, you can type in your question. If your network is poor, you can type in your question. Bumi, go on. Bumi, ask your question. Please go on.
Hello, sir.
Yeah, go on.
Yeah.
Please, what of stationaries?
Stationaries. Those ones are not. Those ones are not Ministry of Health requirement. You can be buying those ones. You mean stationaries like glove, cannulas, drip.
I think he's also having issue with network.
I'm back now. When it comes to stationaries, like somebody asked, that one is not with Ministry of Health come to your facility and be asking if you have a glove, if you have drip stand, if you have a face mask. No, those are your. If you don't want to buy drip, now you as a bit now, maybe it is what you be used to make money. You understand?
Yes.
So the issue of stationaries is basically your own decision. How do you want to be buying? There are some hospitals that like crossing the road to buy stationaries. Bumi, go on. Yes, now they like crossing the road to buy stationaries. So if you want to be that kind of facility, now you sabi. If a patient comes, you give your orderly 100 naira. Go and buy cannula. If somebody comes, you go and buy two pair of gloves. Or you go and buy methylated spirit 5 mils. Oh, who is that, babe? Someone's at the door. Yeah. Bumi, go on.
How to start a clinic?
Yes.
How much can it cost?
It's still the same estimate. The difference is just the name. But for a clinic is being run by a doctor. A clinic is being run by a doctor. So if you are a nurse, you want to start a clinic, and you know that clinic do close. Clinic resume by 8 and close by 6. You are not expected to run 24 hours as a clinic. That's the modalities. So people don't know the difference between a clinic, an hospital, a maternity home, and a nursing home. You must understand that clinic do close. All right?
It's in Nigeria.
Any other thing? But yes, but in Nigeria, clinic run 24 hours. It's illegal. It's illegal. Even some clinic do surgeries. Some clinic do surgery. Myomectomy. Ideally, clinics supposed to be attached to industrial environment, companies. That's what clinic is meant for. Clinic is supposed to be attached to industrial environment like noodles company and Shell. Yeah, minor ailments are treated. Any complication refer to hospital or tertiary institution. But in Nigeria, our own clinic are 24 hours. They do operation. They do operation. So I don't always advise nurses. Even when the doctor approached me that they want to open a clinic, they draw my ear. Are you sure it's a clinic? Or you don't know what clinic is? They will tell you, tell me the difference. When I begin to explain to them, they'll say, no, hospital. So you must understand the difference. Because when Ministry of Health catch you on Monday morning and they saw a surgical case on the floor, the fine is 500,000. Let me show you. Let me show you their fine. Let me show you their fine. It's 500,000. Let me show you their fine. Yes, when they catch you with cases that they are not supposed to find in your hospital, you will be paid a fine of 500,000. I want to show you now. I'm coming. Because this is where many hospitals run into troubles. Okay, see, look at it. Okay, renewal. These ones are renewal. If you want to clinic, hospitals or health facilities are renewed every year. To renew a clinic, which is situated inside industrial environment, is 10,000. To renew a private hospital is 20,000 every year. To renew a nursing home is 10,000 naira. To renew a maternity home is 10,000 naira. To renew a laboratory is 10,000 naira. It is only hospitals. It is only hospitals that is 20,000. That to renew it with Ministry of Health every year. Then IVF Center, to renew it every year is 100,000 naira. To renew IVF is 100,000. You can see them. Okay, other fees. Now, you can upgrade. What I always advise nurses is that you can start your facility as a nursing home. Then when the facility is now busy, you can now upgrade your facility. It is allowed to upgrade your facility from a nursing home to hospital. You will have to pay 20,000 naira. That means your facility is now so busy that you can now pay a doctor. Or your nursing home is now so busy that you can now pay a doctor. So you can upgrade. you can upgrade. Now, let's look at the fines. Let's look at the fine. For example, you are operating a nursing home and you are now doing surgery. The Ministry of Health now catch you that you are doing surgery. What is the fine? Let's look at it. I'm trying to bring out the fine. Sorry. Okay. Okay, Porter. Let's go to Porter. Let's go to Porter. Okay, but I don't want to waste our time, but be aware that the fine sometimes can be as deadly as 500,000 naira. Can be as deadly as 500,000 naira. So one has to be very, very careful. One has to be very, very careful. Okay. The fine can be as deadly as 500,000 naira. Let me see if I can log in. Okay. Okay. So let me not waste our time, but I'm trying to, I need to log in for you to see the fine, but can't log in at this hour. So any other question? Any other question? Any other question, please?
No, let's move on.
Okay. So nobody is having any other question. All right. So, okay, Bumi, go on. Bumi, go on. You're raising your
I
hand.
have a question.
Go on,
I'm
Bumi.
raising my.
Go on.
Is that right? What you said, if a nursing home or maternity home is very busy, the person can upgrade to
An
a
hospital.
hospital.
Yes.
Yes. And you said for a hospital or maternity, 4 beds.
Yes.
So it means the person cannot exceed that 4 beds.
You can exceed the 4 beds, but you cannot be lower than 4 beds.
Is okay.
You cannot be lower than 4 beds. You can have as 50 beds, 80 beds if your hospital can accommodate it. But you cannot exceed it. Maureen, go on.
Good evening.
Good evening.
I would like to know what has been the challenges so far since you started. Any litigation?
No litigation. But that doesn't mean that you have to be careful. You have to be careful. The challenges so far is the persistent monitoring by Ministry of Health to ensure quality practice. Put so much responsibility on you to be on your toe, to have qualified personnel working with you. Like I always say, and advise nurses secretly, I will say it openly. If you are a registered nurse and you want to open an hospital, you can make use of CHU. All these ones that nurses are saying, don't employ this one, you really don't understand. A baby that is put on the back does not know how far the journey is. You can employ a CHU. CHU spent 3 years in School of Health, same thing as registered nurse. And from my understanding, even the true certificates these days are becoming more valuable than registered nurse certificates. So yes, even the true certificates. I'm not saying the JTO, I'm saying the senior two that spent 3 years in school of health. Yes, their certificate is known as HND. They can go for youth service now. Meanwhile, a registered nurse cannot go for youth service. So they are known as HND now, the senior two. We spent 3 years in school of health because their school is polytechnic. So you can employ them because now Ministry of Health has recognized them. And these people can collect 18,000 naira, 15, 18, 20, 25, depending on your state. So the challenges is Ministry of Health persistent visiting. Number 2 challenge that we normally have, power supply. You have to run generator. There is no light in Nigeria. As I'm talking to you now in my house, I am running fear to do this webinar. And in my clinic, which is not far from my house, I'm also running fuel. So you have to buy fuel. If you have a patient on admission, you don't want to hear that you don't have light. So the challenge is that you must have a standby generator. Do you understand?
I do.
Number 3 challenge, I hope you're writing it down. Number 3 challenge is patient-relative trouble. You will treat these people, they don't want to pay their bill. They'll be asking you, what have you done?
They can cause trouble, I swear.
So what you need to do is to write out the price of your services. In my clinic, if you come to open a card, who is showing me granite? Who they pick this night? Favor. Anyone picking beans? They pick beans. By 9:58, we are picking beans. Later, you will wonder why your stomach is big. Now, number 3 challenge.
Preparing for a school run.
Challenge is patient wahala. Some of these patients, if you don't write out your price, they will use you to shine. With Emma Binu, Ejo, we were not expecting it. We never planned for it. Who planned for hospital? I have been practicing for the past 7 years. Nobody has ever planned for hospital. Nobody keep money in the bank. So they will use abeg to blind your ear. That is why you must separate yourself from anything that has to do with financial matters. Let your staff handle it. Because when you are involved in patient bill, that is where they can beg you.
Yes.
After seeing patients, make sure that every of your item to the list injection have a price. I told all my staff, I said, card is 2,000. Admission deposit is 15,000 naira. If you cannot pay, go to General Hospital. General Hospital belongs to you. It's your tax money. When you get there, you can fight with the nurses. It's your hospital.
If you not fight with somebody.
Then I told them, when they pay the 50,000 naira deposit, you have to tell them that a day in that bed is 2,000 naira. A day. Every drugs you give, injection is 500 naira, depending on the injection. Are you hearing are you listening to what I'm saying?
I'm listening. Yes.
Injection, you have to put a price tag, even as little as paracetamol, that is non-lithium. You have to put a price tag, 500 naira, so that when you are making their bill, you have to show patients how you arrive at 50,000 naira bill. You have to show them. Now, drip is 500 naira. As at last year, before coronavirus, we were buying drip 140 naira.
150.
150. But now it's 500, 600.
Yes.
So you have to tell patients, you have to write it out. Everything that you give, you write it out, including the water the patient uses in bathing. You will put it under utilities. It's a serious issue. You are laughing. If you want to do business, you have to frown your face. When it comes to money, you don't smile. When you smile with patients, they will use you to shine. When I'm attending to you, I can smile. But when I want to collect my money, I don't want to laugh with you. They will say, Omo Igbo, he like money. Why am I in Lagos? Did I come to Lagos to come and count the number of bridge Ambode built, or the number of bridge Fashola built, or the number of bridge Tinubu and his boys are building? No, I came to Lagos to pack the money with Ghana must go.
Okay.
So the challenges is all this. You must be ready, because when you want to establish business, you must learn how to talk. All this, I am a very quiet person. I don't want trouble. A businessman is a troublesome person. You must be ready for trouble. That is why you must have police as your friend, who you go every month to go and give a bottle of wine. Make friends with the nearest police station close to you. When the patient wants to bring trouble, you quickly call the DPO. It's very important. When the patient wants to make trouble with you, you quickly call the DPO, because you know that you and the DPO, you people are 5 and 6. And when you make friends with DPO, police will not be harassing you, because there are some things you'll be doing in the clinic that might attract police presence. But when you make friends with the DPO of the station close to you, they will even be the one protecting you.
Like what?
Can you start? When you start, you will understand. When you start, you understand.
Thank you very much.
No, it's not everything you share. It's a little word you will tell a child. The child will incubate it. So it's not everything. You know, there are some things you cannot be taught. Now you go teach yourself.
Yes, business world will open our eyes.
So there are some things that when you will be doing that you will need. Police will be telling you, but when you make friends with them, they will not be. Let me tell you, some facilities do abortion. Abortion is not legal in Nigeria, but go and call police. Now you police go even arrest. You understand? So some facilities do abortion, some hospitals do abortion. The doctors, you cannot do anything to them. So that's just the truth. As some facilities that are used to sell placenta, although all those things are not good. That is